Swadikap, good afternoon once again. This is the English language briefing at the CCSA. As always, we first thank you first to Dr. Apisamai, Dr. Bird for the Thai language edition. First of all, I'd just like to talk just briefly about the nature of our briefing. Of course, the team is a spokesperson's team, so a lot of information come real time. Our presentation is not a prepared speech, nor is it a work of in the newscasting type of delivery. It's more of a real-time spokesperson's delivery from the information that we receive from the various sources. For example, the results of the meeting that we have, the CCSA meeting every morning, the various measures, the different decisions that come from various agencies, and we deliver it for you and to speak directly to the audience as well. So it is not a prepared text. Sometimes we have to improvise according to some information that we have received real time, be it news that have just popped up in social media or in the local press, or immediate results of some meetings that we have just been informed of. So just to give you one example, actually just a few moments ago before this briefing, there was a news outlet that came out with an infographic regarding curfew, that there would be a curfew in 2 days' time in April, the 23rd of April, from 2300 to 0400. I'd like to reiterate that this information is false. It is not true. It has not even been discussed or proposed in the meeting today or yesterday. So we confirm and reiterate that there has been no talk about an actual curfew in the coming days ahead. There might have been some misunderstanding from some news agencies regarding the closure times of various business establishments that had just been announced, that some had to be closed, for example, restaurants, for example, in red zones, and from 2300 to 0400 hours, for example. So just to confirm that. This is just one example of one of the issues that pop up from time to time in real time, and of course this shapes the way that we deliver information to you real time. So following the briefing of Dr. Apisamai just now, I'd just like to recap some observations, but before that, the numbers that we have for today. New confirmed case, 1,458 cases, out of which 1,346 are from local transmission, 108 are from active case finding, and 4 cases are from the state within the state quarantine system. There are 413 new recoveries recorded today, as compared to 1,458 new confirmed cases today. Active cases, as you see on screen in the little green box on top, active cases being treated at the moment in Thailand total 17,162. We have 2 new fatalities, making the accumulated total of fatalities standing at 110. And for these two new fatalities, fatality number 109 and 110, the first is a 56-year-old female who suffered from diabetes and kidney disease as well as obesity. And the 110th fatality is a 32-year-old male who had allergies and suffered from lung disease. So our sincere condolences to the 2 fatalities that we have recorded for today. Now, just some observations from the presentation. You saw some graphs and maps as always in the Thai presentation. Basically, the nationwide graph and number now is kind of fluctuating up and down in the past few days. We hope that it will remain stable and low, hoping that it will become in the lower 1,000s soon. Right now, it's around 1,300, 1,400, 1,500 per day. Today, particularly 1,458. So we hope to try to maintain the numbers to be at the lower thousands, hoping for your cooperation on that. The risk factors still remain. The risk factors being the entertainment clusters as well as markets and the movement of people inter-provincial. One issue is about home isolation as a protocol. So with the ongoing management of beds in the field hospitals in particular, the protocol for home isolation had been applied and had been advised in terms of to those who have been found positive that they would have to be in home isolation and do the necessary precautions and practices during home isolation while they are awaiting for the hospital beds in the field hospitals. The Emergency Operations Center, or the EOC, also had a meeting this morning and discussed on the news regarding the after effects, the side effects of certain individuals who had been facing with certain symptoms, after effects of after having the vaccine shots. And those conditions included stroke and CVA. However, after discussion and examining the information received, actually the after effects are not of full stroke, but then they are actually conditions which are similar to stroke, but not the actual stroke itself. So therefore, each after effect of the vaccines would be studied on a case-by-case basis, and rest assured that the EOC, the Emergency Operations Center of the Ministry of Public Health, is looking into each individual case of each after effect from persons taking the vaccine. So we'll report that to you in due course when we have more information regarding the various after effects. So just some additional pieces of information for today. Firstly, just some suspension of services. For example, by the Bangkok Metropolitan Administration, or BMA, they announced that 50 district offices will suspend all services from Saturday, except on issuing birth and death certificates. The workers from Cambodia, Laos, PDR, and Myanmar who wish to issue or amend their personal records at the BMA offices may visit for service on Monday to Friday at 1600 to 1800 hours, specific times for this specific service. And the number of service recipients will be capped at 30 persons per day. The BMA also providing online queuing system in an application called the BMAQ application, and you have a hotline there on screen for you. This is to facilitate the appointments for people who come for specific services and to reduce the density of the clients in the districts. These measures will be in effect until further notice. So limited service with limited time for the BMA. Another issue about the operation times, I'll skip over to the Thailand Post. Thailand Post, because of course everybody uses Post for particular package deliveries and the like. The operation times for the post office has changed as well. All post offices around the country are changing their times. This has been effective since Monday, the 19th of April 2021. For example, the main branches in Bangkok and other provinces will open until 1800 hours. The smaller offices, for example, post offices attached to gas stations, will open until 1700. And the branches in department stores and airports opening until 1900 hours or 7 p.m. So this is for Thailand Post. Another piece of information, I'll go back to the, there's a official line account application for people requesting beds. So the hotlines, as you know, 1668, 1669, and 1330. Those are the hotlines for medical emergency needs. And regarding the hospital bed request for the general public, these hotline numbers have actually been overwhelmed with a large number of people requesting beds. So the government has created another additional channel for patients to find beds through the official line application. And this can be accessed by adding the Line account, official Line account ID, which is at sabaidbot. And you have that on screen, at sabaidbot, to receive the quickest information regarding beds available and quickest medical attention. This is in addition to the 3 medical emergency service hotline of the government that I had mentioned just now. Another piece of good news is that the Department of Corrections, they have a hospital. So the Department of Corrections Hospital is offering COVID tests to the general public. This is in addition to the various private and public hospitals that have the services of providing COVID tests for those who have been at risk. There were many online queries regarding the testing facilities of COVID during these past weeks, of course, that still have the capacity to receive those coming to test. Now, the Department of Corrections announced that the correctional hospital on Ngamongwan Road in Chatuchak district in Bangkok will be open to the general public for COVID tests from 8:30 in the morning to 2:30 p.m. on Monday to Friday, and the maximum number is 100 tests reserved for the general public on a daily basis, and the results being sent to the person via SMS. And for more information, you can contact the number 02-953-3999 extension 1345 for this additional facility in testing for COVID at the Department of Corrections Hospital. Now, mind you that this is for the general public, okay, not for those who are incarcerated in the Department of Corrections facilities. So basically, this is the information that I have for you. We will be updating information for you from a daily basis, hoping that the numbers will not go higher than what we have seen in the past few days. And mind you that one important piece of information is that don't spread misinformation or disinformation. There's a difference between that, of course, misinformation and disinformation. So as I mentioned in the beginning of the briefing, there might be some news outlets which have been circulating news which is erroneous, which had not been confirmed. That's very important for everyone to do fact checks. Now, there are many facilities to fact check, to listening to official news sources. There are many private entities doing fact checks, cofact.com or others, and you can compare the information that you have with the releases of the government. Okay, so one example I gave earlier, just in the beginning of this briefing, was about curfew. There seems to be some misunderstanding still until today. Even if we had announced that clearly in the past week already, and it had been announced officially and implemented already, all the closing times, all the various new measures for convenience stores, for restaurants, for flights, not operating between 2300 to 0400, but not curfew. Not curfew. Curfew was not something that was announced, and it's not something that will be implemented in the coming days. The news that came out was that there's an exact date, actually, in 2 days from now, that there would be such measure, which is not true. Okay, just to remind you that disinformation is very important for us to avoid in this day and age. It's very important for all of us. So thank you very much for your attention, and we'll see you again tomorrow. Thank you, and สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะสำหรับรายการช่วงบ่ายค่ะ NBT รวมใจสู้ภัยโควิด -19 แอดทำเนียบรัฐบาลนะคะวันประเด็นเรื่องของเตียงนะคะก็จะมาพูดคุยกันมีผู้แทนทั้งจากในส่วนของกระทรวงสาธารณสุขและกรุงเทพมหานครมาเจาะลึกในประเด็นค่ะว่ากระบวนการเรื่องของการจัดสรรการบริหารเตียงสำหรับผู้ป่วยโควิด -19 มีแนวทางการบริหารจัดการอย่างไรและถ้าเราเป็นผู้ป่วยหรือว่าญาติผู้ป่วยการจะหาเตียงหรือว่าการจะติดต่อในช่องทางต่างๆควรทำอย่างไรเพื่อที่จะให้เกิดความสบายใจมากที่สุดนะคะติดตามได้ในเวลา 14 นาฬิกาวันนี้ค่ะทางช่อง 2 NBT 2 HD ส่วนวันนี้การแถลงข่าวจากศูนย์บริหารสถานการณ์โควิด -19 จากที่ทำเนียบรัฐบาลหมดเวลาแล้วนะคะดิฉันปวีณา ฟักทองพร้อมทีมงานลาไปก่อนสวัสดีค่ะ